In the coming months, the Rockford area will see a new rideshare service for mental health care. This comes shortly after the Region 1 Planning Council releases a study about health and transportation in the area. WIFR News reporter Alyssa Kelly talks with the Region 1 Planning Council about when you can expect to see them implementing mental health transportation improvements and expansions.
R1 says up to 1/3 of regional mental health care providers report patients not receiving necessary services is a significant barrier in the area, and they hope to change things.
You're looking at hundreds, if not thousands, of lives that could be impacted.
The Region 1 Planning Council's recent study dives deeper into the impacts that our region's transportation system has on community health, positive and negative.
One of the things that we learned is that while we have a lot of great mental health resources in this community, people are still having trouble getting to all of their mental health appointments.
To fill this gap, R1 partners with the Winnebago County Community Health Board to explore and implement rideshare programs to provide transportation for mental health care services.
That will provide either door-to-door or curb-to-curb transportation to mental health appointments.
R1 learned about this initiative through the McHenry County Health Board. They will use Kaizen Health, a third-party ride-shared service specializing in taking patients to their appointments, to make this possible.
When we looked at best practices, we were looking at what other mental health boards near us also use and getting their testimonials in terms of how successful those programs have been.
R1 tells me the service is ready to be deployed quickly, coming in the following weeks to months, and will come at no cost to the client or healthcare provider.
We worked with members of the Rockford Regional Health Council, and about 60% of the responses that we got on a communications form from them indicated their clientele has a high level of need for transportation services, so it's definitely something that will be impactful.
There will be a web portal healthcare clinicians will use to schedule appointments. Some local organizations funded by mental health sales tax will also be trained to use it.
R1 explains transportation will be scheduled through the clinicians to ensure clients are able to get to their appointments on time.